the first time I've ever talked into a microphone. Thank you everyone for being here today. My name's Isabel. I'm a research assistant with YSpore. I'm new to the Yukon and I'm so happy to be here to learn and learn from all the amazing people at YSpore and learn more about the territory. Yeah, so I'm going to take you into the 2025 Yukon Healthy Living Study. That's what I'm presenting on today. And I'm here with Caroline Sparks, who's here from RPay. So this project is a collaboration between YSpore and RPay. RPay is the Recreation Parks Association Yukon. They're a not-for-profit here in the territory, and they work to provide recreational activities and programs, particularly focused on rural communities. They're really passionate about getting people active outside, and that's the reason why we're collaborating on this project. So for some background, the first Yukon Healthy Living Study took place in 2009. It was focused on understanding patterns and preferences of Yukoners in relation to physical activity. There was a lot of information gained from that, but one of the really amazing things that came out of it was the Winter Active for Life Equipment Library. That program takes place in lots of rural communities, and RPay lends winter equipment and gear to different groups and people so that they're able to get outside in the winter and reduce that cost of equipment barrier. And it's been really successful and helped out a lot of people in different communities in getting outside and staying active. And then in 2016, there was the next rendition of the Yukon Healthy Living Study, which was just sort of building on the first one. And then in 2021, there was kind of this hybrid online version of the Yukon Healthy Living Study, and that was particularly focused on understanding how the pandemic was affecting Yukoners and their physical activity. And that takes us now to 2025. So again, we're going to build on the past studies, understand the patterns and preferences of Yukoners around physical activity. And this is because understanding physical activity from different cultural and rural perspectives provides opportunities for programming that are culturally meaningful and support community priorities. And that's really the goal of RPay and YSport in this project. And we're going to use a survey to collect data for this project, which takes us into our advisory group. So right now we're in the very final stages of putting together this survey. And to do that, we used an advisory group with people with lived experiences, people from the Yukon government, RPay, and YSpore. And we sat down and had a few really amazing meetings to develop this survey tool and to create a tool that's able to capture all the diverse ways that people in the Yukon are physically active and try and move away a little bit from that white horse centric view of physical activity, because we know that's not just what the territory is. And we want to be able to capture all the different ways that people are active here in the Yukon. So yeah, we're going to be using that survey next summer to collect data to understand what physical activity looks like in the territory. We're going to be administering it online as well as in person. And our hope with that in-person administration of the survey is to reach those rural communities, which can be a lot harder to reach, obviously, with online surveys, as well as sort of a more diverse age group. We're hoping to be able to talk to some elders and get their perspectives and lots of different people in every community, because that helps us create a better picture of what physical activity looks like in the Yukon, which can help sort of guide the funding that comes in and hopefully create some meaningful change for those communities. In order to connect with people in communities, we are hoping to attend some events. So for example, in Whitehorse, we're thinking about going to the fireweed markets in the summer. If you have an event that you think would be a great fit for this, please come see us after the presentation. Or if you'd like to help out in any other way, YSport is really big on building research capacity in communities. And one thing that we're also going to do on this project is work with junior researchers that we have in different communities to help us administer the survey. And that's building capacity in that way, as well as working with other people in communities. And yeah, that's the end. Thank you so much for your time. If you have people who would like to help, please let us know. You can talk to Caroline or myself. Yeah. And now I think we're going to pass it online. We're going to pass it now to Caitlin online.
Okay, I'll share my screen here. You guys see my slideshow? Screen sharing is paused. Is it working? Yep, perfect. Okay. Hi, everyone. My name's Caitlin. Thank you for having me today. I've really enjoyed learning from everyone. I'm doing research under Dr. Michelle Leach on the health human resource crisis in the Yukon. So today my plan is to just share some key findings from my recent literature review. So, healthcare worker shortages are a challenge across Canada, but in the Yukon, the issue is amplified by its remote location and the fact that you guys have an aging population. So, if you look at the age distribution on the right, you'll notice fewer young people and a top heavy structure with more middle aged and older adults. So, this means higher healthcare demand from those older residents and then fewer younger people to fill in essential healthcare roles. Adding to this problem, the Yukon has limited local health training programs and complex licensing for new or international professionals who want to come to offer relief. And then those who do come face high housing costs, which makes it really hard to settle. So, what does this all mean, especially for the patients? It means an understaffed healthcare workforce, hence the health human resource crisis. And this translates to longer wait times, overworked staff, and compromised care. So, for instance, in 2023, 20 to 40% of the nursing positions in the Yukon were vacant, and 17% of Yukoners didn't have a family doctor. So, to tackle the Yukon's healthcare workforce challenge, the government of Yukon and the Yukon Hospital Corporation formed a Health Human Resource Steering Committee in March of 2023. And I listed some of the collaborators on the slide on the left there. And this led to the development of the Yukon Health Human Resource Strategy, which basically outlined 25 goals focused on creating a supportive healthcare culture where workers from the Yukon or moving to the Yukon feel motivated to stay. So the strategy has 5 main pillars. The first is retention, so keeping current healthcare workers in the territory. The next is recruitment, so attracting new talent to the Yukon. And then the other pillars are long-term planning, innovating new technology and care models, and then also building education pathways for Yukoners who want to enter into the healthcare field. So in my research, I've focused mainly on the recruitment and retention parts of the strategy. So first, looking at recruitment. Since December of 2022, the Yukon's Department of Health and Social Services has recruited 60 nurses, 44 RNs, and 16 LPNs, and also allocated $2 million in funding to recruit and retain health professionals across the territory. So I've included a figure to show how the funding was distributed, if you're interested. So despite these efforts, why is recruitment still a challenge in the Yukon? Well, the literature shows that while financial incentives may help attract professionals initially, they're rarely enough for long-term retention. And today's healthcare workers want comprehensive support, including a work-life balance and a positive work culture. Another key issue in recruitment and subsequent retention is this mismatch between students' training and the realities of rural practice. So many students train in well-resourced urban hospitals because that's where a lot of medical schools and nursing schools are. They're in big cities. So then when they move to rural areas to practice, there's often a gap between the expectation and the actual demands of the job. And the literature shows that this can lead to a sense of dissatisfaction that kind of stifles the retention rates. So to address this mismatch, 2 strategies have helped. The first is allocating medical and nursing school seats to students from rural backgrounds or those interested in rural practice. This kind of brings in people who are already familiar with these settings. And the second is adding rural-focused content to the curriculum to better prepare students for the challenges they may face in rural healthcare and emphasizing like close teamwork and a broader scope of practice. So for example, many schools now offer rural residencies, and UBC is actually kind of leading the way with its rural and northern pathway, which allows rural medical students to stay connected to Indigenous communities throughout their medical training from year 1. So usually after year 4, they could go into a rural residency, but UBC, they can actually be connected from the beginning, which is a really great opportunity. So now let's look at retention, which is just as crucial for a stable and resilient healthcare workforce in the Yukon. So my research came up with 2 main points that were consistently cited, and the first is generational preference. So younger healthcare workers actually value flexibility and work-life balance a lot more than like the financial compensation, and rigid work schedules actually increase turnover among them. whereas older workers are more focused on how they perceive their work to take away from their family time. And it's called a work-family conflict. This means that the Yukon may need to use different retention strategies depending on the priorities of each age group to keep healthcare professionals engaged and satisfied in their roles for maximum retention. The next one is the home bias effect, which is basically the tendency for people in rural areas to return and stay in their communities. This is talked about pretty consistently in the literature, but the major barrier to its application in the Yukon is that healthcare training opportunities are limited, as the Yukon University only has the LPN and the healthcare aid program right now, but I think they're working to expand. So this lack of local option kind of pushes young people to leave the Yukon if they really want to pursue a career in healthcare, and this can be a significant barrier to students financially and socially. So, learning about the home bias effect and the different aspects of recruitment and retention really hints at the importance of getting Yukon youth interested in health careers and then providing them with ways to stay connected with the community throughout their education, whether it be in the Yukon or if they have to go somewhere else to pursue it. So, how can we bridge this gap? Well, YSPOR is launching a research project to understand the motives of young people to pursue a career in the health field, the barriers they face, and also the support they need. So that being said, we hope to use community and youth input to propose strategies that can support youth in entering health careers and create initiatives that are aligned with local values. So if you're interested in joining an advisory board to help and provide input, we really encourage you to reach out to Dr. Leach at this email here. And by supporting this work, we hope we can better support the Yukon's future healthcare workforce and take concrete steps towards resolving the health human resource crisis in the territory. So thank you.
Thank you, Caitlin. That was great. Next, we just want to introduce our next speaker, Lyris. Lyris Smith. Welcome.
Hi, everyone. I'm Lyris. I work as a assistant professor and health research chair here at Yukon University, and this is really hot off the press. We actually are just a couple days away from hearing that we received this grant, and so I'm here with my partner. This is a co-led project with Marnie Parody from the Yukon Type 1 Diabetes Advocacy Network, and we're really excited, but we're really at the very beginning stages. So I'm just going to pass it over to her. We'll advance the slide, and she's going to give a little bit of the background and importance.
Thanks. So you'll pardon the pedestrian aspect of this because we did just find out, and so this was just thrown together this morning, so please excuse us. The importance of the study, the main takeaways today are that people with type 1 diabetes are seen as an equity-deserving group. They're being underserviced, and a unique aspect of the disease is that if they have all of the right tools and the right training, is they can successfully manage their disease completely on their own. And so it's getting that stuff up front and making sure that people are educated and receive the devices and the proper insulins as early on as possible. Okay. So I don't know how many of you know what type 1 is, but basically it's an autoimmune disease. It can happen to anybody at any time in life. It used to be called juvenile diabetes, but that has changed, and most people are actually diagnosed over the age of 40. It's not related to diet, it's not related to exercise, it's an autoimmune disease, so your body is actually attacking its own self. It's characterized by the loss of insulin production, which means your body can't regulate glucose, and glucose, of course, is what lets your brain actually do the brainings. So it's really important that your body has glucose coming in, but without insulin, it's really challenging to do that, and so people take insulin in order to allow them to actually continue to live. So hypoglycemia and hyperglycemia are the two main characteristics of people with type 1.
So this is our team. We have a very large team working on this, and we're very fortunate. We have a pediatric endocrinologist which will actually help us recruit from a database that he has from longstanding work here. Many people with lived experience on this project as well. So thank you very much. Stay tuned. There'll be a lot more about this coming up. And there's my contact if anybody has any questions.
And that's a fancy little diagram right there. That picture is of actually one of our participants. She's a young woman who allows us to use her name. Her name's Heidi, and that just shows what Dexcom is showing on the phone. The Dexcom is the glucose reader that sits on your arm or your belly. And yeah, see all the data? It's important for people to know what that means. Yeah. Thank you.
Thanks. So I'm just taking the indulgence because we just actually, a couple weeks ago, we received another grant in partnership with the University of Ottawa. And Izzy's just going to pop that one up right now. So it is a cancer care project. It's a 3-year CIHR project. We have collectively received about $600,000 to do this project and work with 2 First Nations who have expressed interest in the project as well. So I know we're short on time, so we'll wait. The slides will pop through really quickly. And what we plan to do with this project is also use local knowledge to inform cancer care. So it has to incorporate Indigenous ways of knowing and doing, where the data will be owned, the methods will be directed directly from the 2 communities that we will be working with, and we will be using staff that we will hire from within the community that aren't necessarily academic researchers, but have a knowledge of the community, as well as elder advisors. You can go next. Okay. Maybe we can't. Okay. Anyway, we had several objectives, and really it is about gaining the perspectives from the community itself on the best ways that we can advance cancer care and support cancer care and bring those recommendations forward to the system. So, thank you. Sorry, to be asked? Oh, yeah. So we have Vuntagwitchin First Nation in Old Crow, and Little Salmon Carmacks First Nation.
How does this fit in with the Equal First Nations Cancer Care Strategy that's already been in place for the last 10 years?
Great question. Yes, it fits in the sense that we're actually, hopefully will be brought into their advisory group, and they will be a part of our advisory group on the whole project as well. So we make sure that we're not duplicating work that's done, and we want to make sure that we're just focusing on the specific communities that we're working on. It's not a whole territorial project at this point. So it's mainly. Yes, there's definitely been some that story collection and that kind of thing that have been done over time. So yeah, but this was brought forward with communities asking us to go forward with the grant applications, and yeah, so we're hoping to take it in a direction that supports whatever the communities are wanting with the project.
I think that's,
Okay.
Thank you, Lyris, Parity, Isabel, and Caitlin. That was amazing.